Hey guys, this is Dr. Rashmi. We welcome Mansi Shilsakar here. So happy to have you.
Thank you so much, Dr. Rashmi.
So many times, patients come in our clinic and they have some sort of issues. Either the male partner comes with some form of male infertility, or the female comes with female infertility, or both as a couple sometimes have issues, right? We see this creates a sort of disharmony, either within the individual or with them as a couple. And it sort of percolates in all the aspects of their life.
Yeah.
So today, this is what I want to discuss with you, how infertility affects your mental health and how even working on the mental health sort of will help counter their infertility issues.
Absolutely.
Right?
Yeah.
Okay, so let's walk through different stages of infertility treatment as a journey that the patients go through, and let's see each issue as it comes up with and how we can deal with it.
True. Absolutely.
Right. So, the patients come in our clinic and they start off by doing a battery of investigations. And we as doctors tell them that, ye barabar nahi hai, ithe kaitari chukta hai, ke some sort of problem we have encountered in you. So, what are the mental repercussions of first the doctor telling that, this is your problem, this is the issue?
Yeah, absolutely get it. I feel fertility is such a natural process basically. म्हणजे pregnant राहणं हे खूप जणांसाठी खूप naturally येतं and it's a instinct for many women and rather couples. Knowing that there is a challenge and it won't be a natural process anymore, itself comes with shock, emotional shock, and accepting that as a challenge, I think emotionally is very, very traumatic, not just for the female, but for the couple also. And not just that, but now we have to go through process to, have that little joy in our life. As I can see, as a mental professional, I feel it comes with helplessness, hopelessness, fear whether it will happen, and the shame, embarrassment attached with it, that it's going to be a technical process, not a very natural process for us. And mostly, unless and until that shock settles down, what happens? It is either a blame game or complete disconnect between the couple till they settle down with the fact that now I need to do something about it, or we need to do something about it.
So that processing is what we are talking about,
yes,
right? That
yes.
Acceptance and then processing. Correct. That we have to go through this together as a unit. And even that I think plays a lot, because sometimes we see the female has accepted but the husband is not, or vice versa can also happen.
Yeah.
So that sort of friction that needs to settle down, right?
True.
So like a little bit of counseling during this time would go a long way to counter these issues.
Correct. Because like I said, it is not just a technical process, biological process, but it is also an emotional process for both of them. And it's unpredictable who will settle down first and who will be able to take it courageously. So if they both are on the same platform and they individually as well as couple get through this counseling process, maybe the later journey would be much more easier for them as a unit. As a team.
Absolutely. We've also come across cases where literally, one partner has dragged the other partner ki nahi abhi jana hi hai, and the other partner comes so reluctantly. So they're both on completely different pages in their journey to conceive a child, right? So that is, I think, one of the most difficult scenarios to deal with, because dragging somebody over there is not anyway a good idea, but the other partner has to tag along. Or sometimes we just see one person undergoing treatment, and most of the cases I've noticed the females coming first.
Correct.
And then when we ask him, where's your husband, and he's like, no, wo nahi aayenge. And really, I think one of the most important points that we can give away is that fertility is a couple issue, and we need to deal with it on a couple level. It can't be just one partner coming to us.
Right.
So this is one of the most important things, I think, getting on the same page.
Yes, absolutely. Right. Like you said, it's a couple issue, and not just fertility or not just being pregnant. Okay, the entire journey has to be together. So conceiving a child, it has to be the couple involved in it, and then taking care of the entire process emotionally, physically.
Absolutely.
All forms, right? It has to be both the individuals involved. If, like you said, if it is a dragging, then the emotional issues are much more, traumatic and difficult to deal with. I think.
Like the emotional baggage is carried by only one of the partners.
Yes, absolutely.
Right. Absolutely. Sometimes it so happens that we run a battery of investigations on a couple, and we don't necessarily end up with a conclusion कि कहाँ नहीं pregnancy रहते, कि वह कहाँ नहीं conceive होते, कि वह कहाँ abortions होता है. So there is not always a clear-cut answer in infertility. So the term which we usually refer to is unexplained infertility.
Okay.
Now, असं झालं की we usually notice a lot of confusion in the patients. So what happens in their mental level?
Yeah. So मला असं वाटतं की see when you know the solution, you know which path I have to go ahead with, and I perhaps know the resources which I have to tap while I'm on the path. But here it's something really personal, and talking about it to family members and talking about it to a doctor, and when the doctor says that there is no clear-cut diagnosis in medical terms, right? And then it's like I don't know what is going to happen, right? The fear of not getting pregnant, not having my dream fulfilled, and the sadness along with that. I guess it's so hurtful for maybe the women first and then the couple. I feel as a mental health professional, it must be affecting their self-esteem. That why is it not happening to me? Why me?
Why me?
Right?
Yeah.
That question is खूप commonly येतो की हे सगळ्यांना होतं मला काय नाही. याच्यापासून मलाच काय ह्या सगळ्या डिफिकल्टीज मधून जायला लागतंय आणि ते पण माहिती नाहीये. So the cause is unknown, whatever, like you mentioned, the abortion, not able to conceiving, but still not,
Carrying it forward.
yeah. So with all of that, I feel helplessness, hopelessness, frustration of, going through that rough patch, and then here the doctor is saying we have to go through the series until, you realize, like as a unit, as a team, you realize that this is where we have to work upon.
Yeah.
So I feel that why me question for that couple results into a lot of emotional challenges, like I mentioned, embarrassment, frustration, sadness, anger towards self, or at times even the partner. Yeah, that तुझ्यामुळे नाही होत. See, तुला हे सांगितलं होतं, तू नाही केलंस हे.
Right.
So तू गोष्टी फॉलो करत नाही म्हणून हे challenges येतात.
Right.
So that blame game is also, it affects the harmony in the couple as well.
आणि एस्पेशली आपण बघतो अनएक्सप्लेन इन्फर्टिलिटीमध्ये देयर इज लाईक अ लॉस ऑफ क्लॅरिटी, बिकॉज
Absolutely.
माहितीच नसतो की पाथ कोणता आहे. कारणच नाही सापडलं तर मग काय पाथ घेणार त्याच्यावर.
Correct.
So many times we see patients usually go doctor shopping in these scenarios. They are like, okay, ह्याच्याबरोबर नाही सापडत आहे, मग त्याच्याबरोबर ट्राय करू. They repeat sometimes the whole battery of investigations, repeat treatments, इथे तिथे जातात, and so the way is sort of lost.
Right. I feel, Rashmi, it's also about the trust, because they are not getting the solution, they are not getting the cause.
Right.
Okay, they would go and find out from where I get the best possible option and best possible answer, or maybe the guarantee that you come to us and we'll be definitely able to do it with you. But at the same time, along with this trust issue, I think somewhere on a solution part, what is important is that believing in one doctor, whatever queries they have. I'm sure they must be having a lot of queries with the unexplained cause and the entire process, the batteries that they have to go through. So they can take as much time as they require to understand how the process is going to be, whatever queries they have. If they can ask the doctor, I'm sure there are doctors who explain and give time to the patients. Right? So if that process happens, then that trust in the doctor, in the entire medical system, and them, like between them, would definitely help them to find out the solution and figure out what path they really want to go for.
Correct. So the harmony between the doctor and the patient, and also in between the couple.
Yes, interpersonal relationship.
Right. हे जेव्हा synchronously होईल ना, तेव्हा the journey becomes much more, let's say, easier.
Right? ते काय म्हणजे खूप pleasant नसणार आहे definitely, पण at least that belief in the system that would help them go ahead with the process with some peace of mind.
Absolutely.
Less negative emotions, and more trust in the entire system. And I guess that would help.
Absolutely.
In the process, the medical processes that you need to follow with the couple.
Yes. So मानसी, कधी कधी आपल्याला असं दिसतं ना की पेशंट्स जेव्हा येतात डॉक्टरकडे, आय हॅव ऑल्सो डन दिस, आय टेल देम लाईफस्टाईल issues to fix, right?
Yeah.
And sometimes the underlying cause may be some level of obesity, sometimes there's smoking, tobacco, alcohol usage, chronic stress. We see career-oriented people, they are doing night shift, and all of this, sort of plays a big role in infertility. आपले hormones चे axis जे असतात किंवा even other factors like how obesity will affect your fertility and even the carrying capacity later on, and everything is affected. So when I give off these advices to patients, I find that it's like a checklist for me ki hey kara. But what happens on the patient's side, how do they deal with it? I never think about it ki tanna what do they have to go through at that point, right? So if you can shed some light on that.
Yeah. See, आपण जेव्हा लाईफस्टाईल चेंजेस असं म्हणतो ना, सो आय फील दॅट इट्स नॉट ओनली रिलेटेड टू इन्फर्टिलिटी, बट देर आर सो मेनी mental health disorders which are because of the lifestyle also, right?
Okay.
So I feel if we focus on infertility and lifestyle changes, I feel चेंज असं म्हणल्यानंतरच खूप सारं प्रेशर बिल्टअप होतं दॅट नाव आय एम इन कम्फर्ट झोन अँड आय हॅव टू चेंज समथिंग दॅट इज काहीतरी बदल करायचा आहे दॅट टू like I have to step out and do something that I'm not used to. Okay, so त्या कम्फर्ट मधनं बाहेर पडणं हे इतकं ट्रॉमॅटिक असतं आणि चॅलेंजिंग असतं आणि प्रेशर येतं ते कारण इथे तर ते अशा रिझन साठी करायचंय की विच इज व्हेरी क्लोज टू माय हार्ट, राईट? सो आय हॅव टू डू समथिंग with this pressure. I feel what happens is many times maybe couples just think that this is what I have to change, this is what I have to bring in my life now, but they don't exactly know what they need to do and what area they need to focus. So I feel हे जर का करायचं असेल लाईफस्टाईल चेंजेस जर का रेकमेंड केलेले आहेत तर फर्स्ट अँड फॉरमोस्ट इज द विजन विथ टाइमलाईन. Right? So if they know that this is what I have to do and this is the area where I need to bring in the change, then they can figure out the goals for themselves, individual and as couple also, and then they can take steps. And like I said, it has to be time-bound process. So त्याच्यानंतर I guess when they will start following the steps, what happens is they actually see the results. Like you said, obesity, maybe ठीक आहे इतक्या महिन्यांमध्ये इतकं माझं टार्गेट आहे. इफ दे आर अवेअर ऑफ इट, देन वेन दे सी द रिझल्ट इट ऑटोमॅटिकली gives them confidence that okay, I am a little bit ahead in my
positive reinforcement.
Absolutely. Correct.
I also see many times, especially in the Indian mindset, help नाही घेत. म्हणजे डॉक्टरने सांगितलं ओके वजन कमी करा किंवा stop smoking. All these things have an emotional baggage attached to it. One is the physical process and second is working on the emotional front. And I feel की दोन्ही ह्याच्यावर हेल्प तर घेता येते ना आपल्याला. सो तो जो अप्रोच एक आहे, एक माइंडसेट जो शिफ्ट आहे की आय एम नॉट अलोन, हे सांगितलंय, आय हॅव टू वर्क ऑन इट, बट देर इज हेल्प अवेलेबल.
इथे जर का मी एक छोटीशी केस सांगू शकले तर आय गेस त्यात थोडासा अजून मदत होईल लोकांना समजून घेण्यासाठी. सो देयर वाज दिस कपल where husband was working kind of, I would say he was a workaholic, and the woman was also working, but somewhere she had a very structured timeline for her job, and rest of the time she would invest in her own likes, passion and all of that, and she was into smoking. Okay, and when they thought of getting into a pregnancy process, they realized that okay, now they need to take help of the doctor because it's not going to happen naturally. And when they started it, the first and foremost reason the doctors identified is there is no contact.
Okay.
Because the husband is constantly at his work and she's doing whatever she wants, and then there was so much I would say argument, तू हे केलं पाहिजे, तू स्मोकिंग सोड, तू आधी घरी आहे. All of that happened for so long with the doctor, and when the couple came for counseling, they realized that as a team they have to work on these issues, and not just with the help of like I would say different professionals, but the people who are really expert in that and they know why they are doing it. So एकदा तो कॉज माहिती असला आणि त्यांना जो माहिती पडला की ह्या गोष्टींमध्ये बदल करायचा आहे, सो ते जेव्हा टीम म्हणून झालं, रिसोर्सेसचा विचार करून कुठनं काय मदत घ्यायची, कशा प्रकारे घ्यायची, आणि ते एकदा प्रोसेस त्यांची प्लॅन झाली अँड देन लॉट ऑफ थिंग्स सेटल डाऊन फॉर देम. सो त्यांच्यामध्ये जे डिस्कशन, आर्ग्युमेंट्स वगैरे चाललेले होते की तू केलं पाहिजेस, मी केलं पाहिजे. डॉक्टरची अपॉइंटमेंट आय गेस त्या बेस्ट जायच्या कारण काही घडलेलंच नसायचं, त्यांच्यामध्ये चेंज नसायचा कुठल्याही प्रकारचा. पण जेव्हा ते या पाथवर आले, आय गेस that is where they really started with the process of the medical treatment that they really wanted to go.
And connecting back.
Connecting back. Correct.
Going on this journey sort of together
Yes.
as a team,
Yes.
and setting those goals and visions,
Yeah.
and then actually achieving it.
Right.
And then actually seeing those things happening in your life
Yeah.
through
Yeah.
the fertility journey as
Yeah.
well. So in a way ही खूप एक fulfilling journey पण आहे. आपण त्याला एक positive mindset ने बघायला गेलो तर things that you've been wanting to work on all these years and ते झालं नसतं आणि या कारणामुळे maybe you can set your life into motion positively. आणि सो हे सगळे जे लाईफस्टाईल फॅक्टर्स असतात त्याचे काम केल्यानंतर जे पॉझिटिव्ह इफेक्ट्स आहेत युनो प्रोसेस इट थ्रू युअर लाईफ. असं नाही की इट इज जस्ट फॉर दिस.
Absolutely no. I guess once you are on that path and you're like I said, I use this word comfort. So when you're comfortable with this path, you can follow it forever.
Right.
So it's not just a temporary change, okay, for a cause, but it's a change which is definitely going to help you even later.
Absolutely.
Not just during the process.
आय थिंक हा अप्रोचच आपला असा पाहिजे. लाईफस्टाईल रिलेटेड जे चेंजेस करायचे आहेत त्याचा हा लॉंग टर्म पॉझिटिव्ह आउटलुकने केलं तर आय थिंक इट्स फॉर द बेस्ट फॉर एव्हरीबडी. Let's also talk about the fact that patients जेव्हा क्लिनिकमध्ये येतात when they start the treatment, maybe it's IUI, maybe it's follicular monitoring, or in the last IVF ची जी प्रोसेस आहे, if you actually go through the process, it's a very intensive process to go through. One is physically intensive because as a woman especially, आणि आपण बघतो की they keep coming back for scans, they keep coming back for injections, they keep coming back taking prescriptions full of pills, right? And these have a side effect profile, like they go through mood swings, bloating sensations, weight up and down, कधी कधी breast tenderness, injection site pain असतं. So there is this sort of side profile over there, right? So ही एक physically intensive process आहे. At the same time we see it's also a financially intensive process. It is an emotionally intensive process, right? So एवढ्या intensity ची process आणि if we go by IVF, so the first cycle pickup ची cycle असते where they are constantly injecting from day 2 to day 12 around. Next month मध्ये transfer process होते. So the shortest possible amount of time that they are investing is 2 months. The longest time is, let's say, 4 months, 5 months. I've had patients, coming back to me for a year worth of treatment, basically. So इतक्या intensive process साठी how do the patients counter this?
Yeah. So what I understand here is, see, there are 2-3 aspects that the couple needs to take care of. One is the emotional aspect. Second is the financial aspect, which I feel is equally important.
Absolutely.
And then is the social aspect, okay, or work, I would say.
Right.
In all these 3 areas, what I see as a common factor is scheduling, okay. So let's say if the couple is working, or the woman who has to undergo all of this medical process, and she's working, then she, I guess, before she starts with the process and when she knows that what she has to undergo, somewhere if she plans how she's going to work and how much time she's going to dedicate to the work, I guess that would reduce her, the need to be there at work, and then she'll be able to deliver at work, which is also, I guess, a motivating factor because she's doing something different.
Correct.
When she's under this emotionally
So that
intense
chain
process.
of thought पण कुठेतरी break
ब्रेक
होतोय.
होतं
She's
कारण तो
investing
चेंज
her time.
गरजेचं आहे तिथे, राईट. कारण फक्त तेवढ्याच प्रोसेसमध्ये असताना जे काय मूड स्विंग्स लाईक यू मेन्शन जे होतात, किंवा अनसर्टनिटी असते की आता हे एवढं मी सगळं केलेलं आहे आणि काय होणार आहे त्याच्यातनं,
Absolutely. Playing on their mind every day.
एक्झॅक्टली. सो तिथे ते सोशली आणि प्रोफेशनली जर का तेवढेच इन्व्हॉल्ड असतील ते अट ऑल दे आर वर्किंग, तर आय थिंक ते जे वेगळी थॉट प्रोसेस मिळते किंवा एक वेगळी डिरेक्शन मिळते विचारांना, दॅट कुड हेल्प द कपल. सो त्याचं आय थिंक सो शेड्युलिंग करणं गरजेचं आहे, कारण आज इन टुडेज टाइम इट इज व्हेरी मच demanding also.
Absolutely.
And again, telling this in the company that I am going through a process now and it is going to affect me physically, mentally, so I will not be able to dedicate as much as I was earlier. And that is where connecting with the senior members of the company and helping them understand what exactly it is itself is a beginning of scheduling what exactly they want in the work area. Financially, like you mentioned, that it can be for some people, for some couples, it can be a year-long process, right? Finances, I think, खूप महत्वाचे आहे तिथे प्लॅन करणं, कारण as much as I know, it is financial investment.
Absolutely.
First and foremost, त्याच्याकडे इन्व्हेस्टमेंट म्हणून बघणं गरजेचं आहे, नॉट ॲज ओके आय एम इन्व्हेस्टिंग माय मनी अँड नथिंग इज हॅपनिंग. कारण इट्स अनप्रिडिक्टेबल कसं काय होतं, जरी तुम्ही 100% देत असला तरी सुद्धा. सो त्याचं प्लॅनिंग करणं फायनान्शियली, की मध्ये ब्रेक्स लागले तर कसं मी ते पैसे ऍडजस्ट करणार आहे, काय करणार आहे त्याच्यासाठी. त्याच्यासाठी काही ती मदत घेऊन त्यांनी ते प्लॅन केलं व्यवस्थित. सो एक चंक त्यांनी बाजूला काढलेला असणार आहे या सगळ्या ट्रीटमेंटचा, आणि दॅट गिव्स सिक्युरिटी की इथे जरी मी इन्व्हेस्ट करते तरी आय नो आय कॅन बँक ऑन समथिंग, and that would also help them, be consistent in the process.
Absolutely, very important. I think financially discussing this with your partner,
right,
taking funds aside, having that sort of extra bandwidth to deal with all these issues. कारण सपोज नाही झालं आपल्या टाइमलाईनवर, सपोज एक्स्ट्रा टाइम लागला आणि सपोज एक्स्ट्रा फायनान्सेस लागले, तर या दोन्हीचं स्केड्युलिंग असलं पाहिजे. सो दिस पॉइंट आय फाउंड व्हेरी इम्पॉर्टंट, की एस्पेशली वर्किंग वुमेनसाठी, बिकॉज विमेन आमच्या क्लिनिक्समध्ये येतात अँड दे हॅव टू वेट. देयर इज अ वेटिंग टाइम एव्हरी डे, एव्हरी टाइम दे वॉन्ट टू कन्सल्ट अ डॉक्टर, गेट अन इंजेक्शन, गेट सम प्रिस्क्रिप्शन, ह्याला वेळ लागतो. सो आणि बऱ्याच वेळेला आपण बघतो की बायका हे सांगत नाहीत त्यांच्या ऑफिसेसमध्ये दॅट वी आर अंडरगोईंग दिस ट्रीटमेंट राईट नाव, विच इज व्हेरी इम्पॉर्टंट की टू अंडरस्टँड दिस, की ह्याच्यामध्ये काही स्टिग्मा नसायला पाहिजे खरं तर. लाईक टॉकिंग अबाउट इट ओपनली, टेलिंग इट टू पीपल अराउंड यू, socially, family wise, friend circle, or at the workplace. Just going out and saying, no, hey, we are having this issue, we are undergoing this treatment, so that people are aware and people can also help you in the process.
मला असं वाटतं की जेव्हा नॅचरली कन्सीव्ह होतं आणि त्या प्रोसेसमध्ये जे मूड स्विंग्स होतात किंवा लो बॉडीली सुद्धा बरेचदा लो फील करतात, सो तेव्हा जेवढं इझिली सांगितलं जातं ना, तर त्याच इंटेन्सिटीचे इथे इमोशन्स असणार आहेत, मूड स्विंग्स असणार आहेत, प्रोडक्टिव्हिटी कमी होणार आहे. सो जेव्हा हे घरच्यांना किंवा वर्क प्लेसमध्ये माहिती असेल तर तो सपोर्ट मिळतो, बिकॉज समवेअर ऑफकोर्स इट्स something that people will understand and they will help if they know what is happening. राईट. सो ते सांगणं, की स्टिग्मा नाही ठेवून ते जर का सांगितलं तर जो सपोर्ट मिळणार आहे ना, तो घेणं पण सोपं जातं, आणि मग तिथे ते आपल्याकडनं जे काय देणं गरजेचं आहे किंवा त्या चॅलेंजिंग पिरियड मध्ये जो एक ब्रेक हवा आहे तो इझिली घेतला जाऊ शकेल. कारण हे सगळं जर का टेन्शननी किंवा प्रेशर अंडर केलं ना, तर ते अजून म्हणजे जे आपण आधी बोललो, जे इमोशनल सगळे कॉन्सिक्वेन्सेस फील होतात, तर ते जास्ती लेवलला होणार आहे.
And there's also a release of having that open conversation, na, that you feel so light ki okay, हे असं आहे, मी ऍक्सेप्ट केलंय, लोकांना सांगितलेलं आहे. So that sort of free flow जो असतो ना, instead of bottling it all up inside, which is very important.
तो ऍक्सेप्टन्स स्वतःला नसला ना, तर समोरच्यांकडनं काही रिमार्क आले तरी ते खूप पर्सनली घेतले जाऊ शकतात, की हे का बोलला असा किंवा हे असं का केलं. सो ते जर का ऍक्सेप्टेड स्वतःला असेल तर समोरच्या येणाऱ्या गोष्टी ऑब्जेक्टिव्हली बघितल्या जाऊ शकतात, कारण समवेअर द पर्सन नोज की दिस इज अ प्रोसेस आय हॅव चोजन, इट्स माय चॉईस. सो त्या चॉईसमुळे येणाऱ्या बाहेरच्या ज्या गोष्टी आहेत ना, ज्याला आपण एन्व्हायरमेंटल फॅक्टर्स म्हणतो, त्यांच्याशी डील कसं करायचं हा पर्स्पेक्टिव्ह आय गेस चांगला डेव्हलप होतो. सो हे सगळ्याच एरियाजमध्ये, आणि कारण जेवढे फायनान्शियल इन्व्हेस्टमेंट करायला लागणार आहे त्याच्यापेक्षा जास्ती जर करावी लागली, एस्टिमेटेड कॉस्टच्या वरती गेलं, सो ते परत चॅलेंजेस आहे ना, की आता काय करायचं. सो ह्या सगळ्या गोष्टींचा आधीच विचार करून ठेवला आणि प्लॅनिंग करून ठेवलं तर खूप इझी जाणार आहे काही या गोष्टी.
So, one of the most heartbreaking points in this journey of IVF as a couple, I think, is when you go through the process of taking the entire treatment, especially when it comes to IVF cycles. But even for that matter, IUI, follicular monitoring, simple treatments, because there's always hope. Every month, there is hope that, this will turn out well. This cycle might work out. And then they invest all these things into that IVF cycle. आणि एंडमध्ये जेव्हा बीटाचा रिपोर्ट करायला जातो तेव्हा तो नेगेटिव्ह येतो, अँड द हार्टब्रेक दॅट कॅरीज इज वन ऑफ द मोस्ट सॉर्ट ऑफ गट रेंचिंग काइंड ऑफ फिलिंग. किंवा अनदर व्हेरी व्हेरी सॉर्ट ऑफ हार्टब्रेकिंग सिनारिओ इज वेन की एवढं सगळं करून पॉझिटिव्ह आली आहे प्रेग्नन्सी, अँड देन यू मिसकॅरी दॅट प्रेग्नन्सी, अँड इन सम पेशंट्स वी सी की हे रिपीटेडली मिसकॅरेजेस पण होऊ शकतात, राईट. सो ॲट दॅट पॉइंट what the couple goes through, because sometimes काय होतं, क्लिनिकमध्ये पेशंट्स येतात, बसतात समोर, we have to tell them the negative news, and they are crying, they don't know what to do, they keep asking the doctor की का झालं आमच्या बरोबर असं, राईट. आणि येस, आम्ही मेडिकली इक्विप्ड असतो ते हँडल करायला, बट इमोशनली इक्विप्ड सगळे डॉक्टर असतीलच का, आणि सेकंडली तो जो टाइम द्यावा लागतो ते एक्सप्लेन करायला, तेवढा त्या डॉक्टरकडे टाइम कधी कधी नसतो, राईट. सो त्या पॉइंटला जो सपोर्ट लागतो हा सपोर्ट द्यायला नसतो कधीतरी आमच्याकडे. सो ॲट दॅट पॉइंट व्हॉट डू यू थिंक हाऊ दे शुड हँडल इट?
Yeah. So actually, the first thing that comes to my mind right now is, as a woman, as an expecting mother, it's definitely extremely traumatic. की आता हे पुढे नाही जाणार आहे किंवा on their own, they have already realized that there is something wrong that has actually happened with us, and now we have to go to the doctor and listen to it from them also. So खूप जास्ती ते सॅड आणि शॉकिंग की एवढं सगळं करून सुद्धा परत काहीच नाही होते, and there is no result in my hand. I'm going through so much. It is definitely extremely challenging part, I guess, of this entire process. मला असं वाटतंय ह्या पॉइंटला ना एक मेंटल हेल्थ प्रोफेशनलची जर का मदत घेतली, कारण मेडिकली ऑफकोर्स ॲज एक्सपर्ट्स विल बी एबल टू एक्सप्लेन इट टू देम की काय चॅलेंजेस येतात, वाय इट इज हॅपनिंग टू देम, बट ॲट द सेम टाइम यू हॅव टू डील विथ अदर और हेल्प अदर पेशंट्स. सो इथे हा जो वेळ त्यांना मिळणं गरजेचं आहे, राग आहे, दुःख आहे किंवा फ्रस्ट्रेशन असतं, वैताग, दॅट्स द राईट वर्ड आय थिंक ऑफ. सो तो एक्सप्रेस आउट होणं खूप गरजेचं आहे. आणि इट्स नॉट जस्ट वन पर्सन, नॉट जस्ट द फिमेल, बट आय एम शुअर the partner is also going through all of these emotions, and then expressing it out in front of each other can be more difficult process for both of them. किंवा बरेचदा घरातले नाही समजून घेऊ शकत किंवा समजून घेतात पण ते घेता येत नाही त्या स्टेजमध्ये असताना. सो इन such scenarios I feel going and seeking help of a mental health professional who knows the entire process and understands what exactly the couple is wanting from them, that will give them the venting out channel to all those emotions. And these mental health professionals, we are all equipped to understand how to give them support, how to be empathetic, how to not give them advices in such scenarios. की ठीक आहे पुढच्या सायकल मध्ये होईल. No mental health professional will be saying that, because what we do here is allowing them to express their emotions and having that vent, which will give them the space, internal space, to be ready for the next medical treatment or the path that they have chosen. Because as we have understood it, it's a choice that they have made, and this choice is definitely full of challenges. Here, what they need is a support which is unconditional, non-judgmental.
सो सेन्सिटिव्हिटी आणि स्पेस हे जेव्हा दोन्ही मिळतं ना, तेव्हा दे कॅन प्रॉबेबली प्रोसेस की काय झालंय बेसिकली माझ्याबरोबर काय झालंय. कारण बरेच वेळेला ते पण झालेलं नसतं, म्हणजे ते इतके इन द मेकॅनिकल प्रोसेस असतात की मेंटली हा इश्यू प्रोसेसच झाला नसतो कधी.
कारण सी ते इंजेक्शन घेणं आणि घरी येऊन मग ते सगळं काय गरजेच्या गोष्टी आहेत त्या सगळं करणं, ह्याच्यामध्ये जे काय इमोशन्स फील होत असतात ना, ते त्या टेक्निकल प्रोसेसमध्ये कधी कधी बाजूला पडतात, राईट. आणि ते बाजूला पडल्यानंतर तो जेव्हा प्रॉब्लेम येतो की आता हे नाही होणार आहे, त्यावेळेला त्याचा जो ब्लास्ट होतो ना, तो डील करणं खूप गरजेचं असतं आय फील. सो म्हणून ती वेंटिंग आउटची प्रोसेस जर का रेग्युलर बेसिसवर सुद्धा ठेवता आली तर त्यांनी तिथे तिथे ते इमोशन्स बाहेर पडले, निचरा होणं जे म्हणतो आपण मराठीमध्ये, सो त्यांनी खूप फरक पडतो.
राईट. सो ऑल्सो अनदर इम्पॉर्टंट पॉईंट की म्हणजे काउन्सिलरकडे आता नेगेटिव्ह आल्यानंतर जाण्यापेक्षा थ्रू द प्रोसेस प्रत्येक टप्प्यावरती ह्याची जर का आपण हेल्प घेतली तर दॅट माइट बी इवन अ बेटर सिनारिओ.
Absolutely. Like I said, mental health counselors, they are non-judgmental, unbiased, and absolutely unconditional. Okay, so what you get there is empathy, not a sympathy, not pity. So when you are getting such an environment which is dedicated to you as a person, as a woman, as a would-be father, you can be your own self and you can express whatever is on your mind, and it's not labeled as positive or negative. So when you are in that process wherein you are getting that support throughout your infertility treatment, that I'm sure is very, very supportive.
Absolutely.
So that openness to this channel, that this kind of support is also available to me, is very important.
So it goes hand in hand, like a doctor and a counselor, I think, would go hand in hand in this journey, right from the start to the end.
Correct. I think it's important that along with the couple, all the other professionals work as team. So it's not just the couple, but all of us going through the process, and we as supportive units helping them, and they are the primary treatment seekers, I would say.
Yeah, absolutely works. So Mansi, in the end, sometimes it so happens की पूर्ण ट्रीटमेंट घेतल्यानंतर negative result आल्यानंतर the doctor is going to end up telling the patient that करता येत असेल तर we go through the entire journey again. But if we have reached a sort of dead end in the process की आता आपण ह्याच्या पुढे नाही माहिती असतं की आता नाही होणार आहे बेसिकली करून सुद्धा काही तो जो ॲब्सोल्यूट एक डेड एंड येतो जिथे डॉक्टर सांगतो की ओके आता दॅट दिस इज इट बेसिकली आणि ह्याच्यानंतर द चॉईसेस ऑन द टेबल आर वन आयदर यू यूज डोनर एग्स or secondly you're going to end up using donor sperms or donor embryo or in the end the doctor is going to say if you don't want all of this then it's going to be adoption तेव्हा हा जो एक टप्पा येतो ट्रीटमेंट मध्ये तेव्हा वी सी पेशंट्स एकदम एक तर कधी कधी शॉक मध्ये जातात की ओ माय गॉड लाईक काही पेशंट्स वी सी ॲब्सोल्युटली डिनायल मध्ये असतात ते म्हणतात की नाही माझं नसेल तर मला नकोय आय डोंट वॉन्ट इट आणि काही पेशंट्स असे पण असतात स्पेक्ट्रमवर की ठीक आहे दे ऍक्सेप्ट की नाही ना होणार आहे ठीक आहे मग अडॉप्शन आहे का ओके दॅट इज ऑल्सो ओके ॲज लॉंग एज वी नीड अ चाइल्ड बेसिकली सो हा जो एक फुल एक स्पेक्ट्रम आहे ऍक्सेप्टन्सचा एक रेंज आहे सो हाऊ डू वी गो अबाउट डीलिंग विथ दिस
So Rashmi, I feel having a baby is, a couple's choice. It just cannot be a single partner deciding that, now I have decided I want to have a child, so you do whatever I ask you to do and follow it. Okay, it just cannot happen that way. And knowing that now it just cannot be, our baby itself is so challenging and so I feel that it's disconnect kind of in the beginning when they get to know that now it's not going to be my child, not my genetic makeup, माझ्यासारखं दिसणारं वागणारं बोलणारं नसणार आहे ते आता and I have to take the help of external whatever resource, right? त्या ऍक्सेप्टन्सला यायला आय गेस वेळ लागतो बरेच वेळेला आणि ती स्पेस तो टाइम घेणं आणि देणं हे इक्वली इम्पॉर्टंट आहे सो ऑफकोर्स डॉक्टर्सकडनं काही मागं लागणं होणार नाहीये दे डू गिव्ह टाइम टू द कपल यू डिसाइड what you want to do. So couple giving time to each other to come up to a conclusion and discussing about it. Yeah, laying down the expectations, talking about emotions because it's a difficult choice to make. आणि त्याबद्दल बोलणं एक्सप्रेस आउट होणं एकमेकांना वेळ दिल्यानंतर जे काय विचार केले जात आहेत त्याच्याबद्दल लॉजिकली की कॉन्सिक्वेन्सेस काय असतील त्याचे आणि ते कॉन्सिक्वेन्सेस घ्यायची माझी तयारी कशी आहे आणि त्याच्यानंतर मग आपण दोघांनी या गोष्टीशी कसं डील करायचं ह्या गोष्टीचा विचार करून देन मेकिंग दिस चॉईस आय फील इज एक्स्ट्रीमली इम्पॉर्टंट अँड देन दॅट वुड कॉन्ट्रीब्यूट इन सिग्निफिकंट choice. I wouldn't call it choice, but I feel significantly contributing in this difficult time when the partner is knowing that okay now she or he is with in different hands altogether.
सो आय थिंक हे हा जो चॉईस आहे व्हॉलंटरी हे दोन्ही पार्टनर्सने अंडरस्टँड करून घेतलेला जो एक चॉईस आहे कारण ह्याचं रिपरक्युशन्स आफ्टर ऑल यू गोना हॅव अ बेबी इन युअर हँड राईट इट इज अ लिव्हिंग ब्रीदिंग थिंग आणि 10 वर्षानंतर हा मुद्दा नाही येऊ शकत की आपण डोनर वापरलाय किंवा हे आपण अडॉप्ट केलंय दिस कॅन नॉट बी बिकॉज यू आर डीलिंग विथ द सायकी ऑफ द चाइल्ड दॅट यू आर ग्रोइंग अप राईट सो हा खूपच एक इम्पॉर्टंट असा डिसिजन बनून जातो
रिस्पॉन्सिबिलिटी ऑल्सो आय फील
absolutely so yeah when both the partners are on the same page and taking that decision accepting it आणि हा पण एक स्पेक्ट्रम आहेच ना की नकोय मला असं नाही करायचं
अगदी
आणि even that should be okay
absolutely
right
at this point I feel if one partner feels that I really cannot go ahead with this kind of a choice it should come with respect and it should come with that openness की नाही होते ना ठीक आहे हरकत नाही मला पाहिजे म्हणून मी तुझ्या हातात मूल आणून देणार असं नाही होणार आहे.
Right.
Ultimately, it's a human life.
Absolutely. So both partners need to grow up the child together as a team.
Yes.
That will play a big role in that child.
Parenting is a journey together.
Definitely. So it all starts from that day's decision.
Correct.
Right? So that is very important. And again, ह्या मुद्द्यामध्ये पण काउन्सिलिंगची हेल्प घेणं खूप इम्पॉर्टंट वाटते मला की एस्पेशली इफ वन पार्टनर्स दिस साइड अँड अदर पार्टनर्स दॅट साइड हे जो एक्स्ट्रीम सिनारिओ असेल तर डेफिनेटली टू गेट द पार्टनर्स बोथ ऑन वन पेज नो मॅटर विच पेज इट इज then that is very important.
करेक्ट. सो ही क्लॅरिटी जी येणं गरजेचं असतं ना, ती कदाचित स्वतःबरोबर विचार करत असताना नाही येत, किंवा वेन दे लाईक आर ट्राईंग टू डिस्कस अबाउट इट, देर आर टाइम्स वेन they have different opinions, and when they're trying to convey to each other, it's not a discussion. It either is a debate or argument or a fight, a very bad fight. So when they are sitting again in front of counselor, what they achieve is the clarity for themselves that this is what I want. And then when they are clear, conveying it to the other person, communicating it to the partner becomes much more easier. So that is where again this objective resource plays a very important role, I think.
So I think that concludes our talk for today on counseling and fertility. And thank you so much for coming here today and shedding light on all these different topics. I think खूप हे important discussions आहेत, आणि हे जेवढे openly discuss होतील तेवढा त्याचा stigma जाईल, तेवढंच conversations will be easier with people. Like and in general life only. Like you can breathe if all these things are out openly discussed. So thank you so much for coming here today.
My pleasure, absolutely.
Right? And if you like this content, do like, share, and subscribe. Thank you.
Thank you.